Good afternoon. Can you hear me? Just please comment. Yeah. Hi, this is Dr. Sanjay from Call Dr. Home Healthcare. We are here. Call Dr. Home Healthcare is a leading healthcare home healthcare provider in Dubai, and we aim to provide the highest standard of the home healthcare possible in Dubai. And this is our first live session on the Call Doctor Facebook, and we will have planning to have more sessions like this over the couple of weeks. Hope you have some more information about us and learn something new about from us. And this is whatever we share on here on live Facebook is all medical literature based. It's not something which we want to say you about, and it is all medically proven facts. Today, I'll just talk a little about our company called Dr. Home Healthcare. We started 4 years back, but this concept, our founder is running this home care practice for almost 12 years, and he's having extensive experience and expertise in dealing with home care, which have a variety of need. Sometimes just primary care, sometimes need advanced care for this. So we are here for 24/7, and anytime, any day, we try to give the best possible services at your home in your comfort. Today our topic is to discuss you about seasonal flu and flu vaccine. What is the role and how can be helpful for us? I know everybody is aware what is flu is. Here today our point is not to tell you something you don't know, but maybe there will be some information for you that may be helpful for you to have some more clarity about the fact. I know people are educated now, they have Google to know about the things, but our point is to give a whatever you read and understand, to give a more scientific view on it. And if you have any question during this, you can message us, and we'll try to answer your question. I'll try to answer, which is be more scientific. Sometimes I'm not able to answer right away. I'll get back to you. So what about seasonal flu? What you hear about nowadays, seasonal flu number has gone. You see a lot of people who's getting sick, cold, cough, and fever. There is a small difference between the cold and the flu. Normally cold is a little milder form of mild, and the flu is because of influenza virus, which infect normally the lungs, throat, and the nose area, the upper respiratory tract and the lower respiratory tract sometimes. Majority of the patient of flu normally get well, but sometimes it can be more severe, can lead to severe illnesses. So that's why, we emphasize there are a lot of preventive measures. We'll come later on about that. And the flu, in flu normally you have fever, more body pain, tiredness. In cold, the fever is little less, and body aches and all are less. So your question is how to differentiate between the cold and the flu. So clinically, there are hints that you can suggest it's a flu or cold, but sometimes it's very difficult to say it's not just the normal cold or it is flu. The best thing to do it, sometime doctor advise you do the flu test. It's very informative, because sometimes if you detect flu in the early time, and in some special cases can be very helpful, so that we can start some treatment which can be very helpful in the long patient recovery and faster healing. In flu, like normally what happens, the illness lasts around a week, and you become infectious from the maybe day one before you start, and it can, most infectious or contagious, how it's first 3-4 days, and normally you must be knowing it well by droplet, when coughing, talking, and sneezing, and it comes to you, and you get, so that you see now this season, because as the COVID is going down, the people number using mask is going down, so the flu number is going up. So blessing in disguise is like last year, because of COVID, people were using a lot of precautions, and using mask, and they were sanitizing their hand and soap. So the number of incidents, what I see, was compared to was very less. So, but this year, because now as people are getting more vaccinated, the fear of going down, but in spite of this, they have more number of flu. This time I've seen a lot as compared to last year. And people comes now like who are high risk of getting this infection and who are more chances of having serious illness. Normally, what they say, they are called susceptible people. They call who are more risk of having a severe illness. Like sometimes flu can lead to pneumonia, sometimes it can lead to inflammation of the heart, and sometimes can lead to the severe organ damage. You must have heard about swine flu, and it is another form of flu, but it's like same, it's flu. Sometimes people can have it. And more people, like somebody who's more than 65, children less than 2 years, somebody with a chronic illness like asthma, diabetes, liver problem, or some brain issues, they are high risk of having a severe illness. And so that's why it's important to take care of this. When you have flu, better to see your doctor, so that if you need anything, we can do. Then normally we have a rapid flu test, and though it's not 100% accurate, but it can be helpful, because I've seen a lot of people we are able to diagnose early with the flu test, and in that the doctor take a flu swab from their nose and send it to the lab. Normally report comes within few hours, and depending on, suppose you have flu, influenza A or B positive, we can start away treatment like some oral medicine that I'll tell you about later on. So that helps in getting the severe illness under control. And this is one thing, complication, high risk people, I tell you. So what do you think? What should I do when I get sick? Normally, whenever you get sick, any illness, especially when you have upper respiratory tract illness, most important thing is try to cover your face, use mask, use hand sanitizer, and try to limit people contact. You see, normally in families, when one gets sick, like one child gets, another guy gets it. See, sometimes it can be mild, but if you take special precaution, sometimes it can be very helpful for avoiding more people to have it. Because when you see one person in the family gets, a lot of people get it. But our aim is to cut down. How can we don't just use mask, wash your hand. If you're not able to wash, use alcohol rubs to clean it. And try to clean the surfaces and things about that. And then people ask how long I have to be in the house. Try to be home, confined, limit yourself for like at least for 24 hours till the fever settles. Okay. So, and we talk about the symptom, we talk about the possible complication, high risk people, and what the flu test we're doing. And there are more advanced tests also, but normally they are there. So flu treatment is, there are multiple medicine for the flu. One most common everybody knows is the Tamiflu, which is a very good drug, which can be given for even for children, even for pregnant women, we can be given. Tamiflu is a very safe drug, and it has to be as early as possible, within best if you're given within 2 days of starting of illness. That's why I said whenever you have a flu-like symptom, better to see your doctor so that you can start treatment early. Because if you start late treatment, suppose 4 or 5 days, they may give you a Tamiflu, but the effect will not be that good as if you start early. Okay. So as the flu number is going on, the question comes, how can we cut it down? Though there are treatment, there are options available. So you must have heard about flu shot, which is very popular nowadays. And after COVID, people are getting more aware of it, because we have flu epidemic in 1920. Now after 2020, people are able to understand that is flu is importance of vaccine, and people keep asking why we take a flu shot every year, like question also come with the COVID. See, because all viruses have a tendency, especially this influenza or COVID, they have a tendency to change their structure. This is basically is survival of a fittest. That is what the point is. So in the flu also there is a flu shot. So every year there is a flu shot which is being designed specially by not by my choice or anyone's choice. This is a WHO CDC guideline. Which strain of virus will be more prevalent this year? They plan the vaccine accordingly. So normally they use 4 different kind of viruses and they make inactivated form of that viruses, and that is being used for producing a vaccine. This is called flu shot. And as per CDC guideline, WHO guideline, everyone above 6 months of age should get it once in a year. And there are people who ask, do I need to take, should I take it? I don't need it. So it's your choice. The point, but choice can be yours, like COVID vaccine. But importance of having flu or any vaccine is to cut short not only the infection and number of severe cases. Even in the flu shot taking, people say I get sick, I want that. No, but you see yourself, if you see in a larger number, maybe around 60 to 80% people don't get a infection after that. So the efficacy is very good. That's why there is, anything which is done being scientifically valued is not done just because they want to promote one thing. They basically, it is collective data. Like it's not about me or 10 people, it's about millions or billions of people. According to that, they make a data. How many people are protected? How many people are safe? That is more important. See, we count as a person, it's me only. No, that is okay, your choice, but best is to take a flu shot. 6 months, anyone should get a flu shot. And sometimes people ask, I want this flu shot, this, and there are another, I want nasal spray. There are limit. Every flu shot is equally good, but you have to contact your doctor which kind of flu shot is good for you, because for nasal spray there are some limitation. It cannot be given to some people like more than 49 years of age, pregnant women cannot be given because this is a live attenuated, that means weakened virus. So they are not given for them. And there are multiple variants and 4 kind of shots are there. And what is the season? This is basically will start from September till February, March you can take it. And whenever you take it, it's best it is. And sometimes people ask, I'm old, my immunity is less, shall I take 1 shot, 2 shot? No. Everybody is allowed only 1 shot because they found it on a larger scale that it is not important that you take 2 shots. 1 shot is equally good. But there are some criteria when to talk, like children, they said as early as available they should take a flu shot. For adults, they said should be taken in September or October in old age, because immunity has to last longer, because the flu season normally peak around winter and fall. And there are some people said, flu shot, what should I do? Sometime I have a sore. Yeah, you can have little soreness, little body pain and all. It is because of every vaccines have little side effect. And some people say, like I had one colleague of us or somebody wanted to say that I don't want to take it because it can cause severe problem. No. See, people are having a myths and they have own information which they don't want to actually talk to the doctor. They just want to do. Even if they Google it, they will find the right information, because in the end everything comes to something else. So there is no serious problem with this. You should very limited. And another question normally comes about egg allergy. See what they say according to CDC. Unless until you have a very severe egg allergy, like whenever you have egg, you get a wheeze or something like chest discomfort, pain or sweating or something like that, you can take a flu shot. If you are, even then you are not assured, there are vaccine which is without egg protein also. And another normal myth is sometimes why get sick after flu shot, or flu shot will make me sick? No, because flu shot is inactivated virus, so it doesn't cause you flu. Another question sometimes, because of if I take a flu, shall I take a flu shot or let the flu come and then have a better immunity? Yeah, you will have immunity by both ways. The problem is this, or question is this: you don't know when you have a flu, it will be mild or severe. If you take a flu shot, there is less chances to be having a severe illness. So that's why they recommend take a flu shot. And sometimes people ask, if I take a flu shot, then I will get a problem with other viruses. No, it doesn't make you susceptible to others. It just gives you immunity to this. That means, like say, if you take COVID vaccine, doesn't make you susceptible to flu. If you take a flu shot, you don't become more sensitive to COVID. Another thing people have asked, and sometimes I had flu shot, even then I was flu vaccine. Even then I had a flu. I told you before also, because it's made of specific kind of viruses, 4 strains chosen. So you can have a flu because of another viruses. First thing. Second thing, it is not maybe flu. There are other respiratory viruses which can cause similar illness like that. So it is not true that I get it because of that. And second thing about one thing, should I take a double? So not needed. And second was increasing the vaccine pay. I think anything else I have covered. I think some more of the topic. And how many shots? Normally one shot is enough. Anyone above 6 months of age should take flu shot. And if anything like problems like severe, then you can talk to your doctor. Thank you everyone for attending it. I think my information helped you a little bit.